Alright, thought we might have another little chat. I'm pretty new at this. It could be a bit rough, but we'll see how we go. So I wanted to challenge a popular meme which we're seeing everywhere from those on the liberal left, on the mainstream side of the narrative around this situation, which we're still not allowed mention by name, which seems to be that anyone holding a dissenting view from the mainstream narrative is a conspiracy theorist and a lunatic, quack, fringe, outlier, granny killer, nutcase, disease carrying, whatever. And that we need to trust the science. And I have some questions about that, because from my perspective, what I see is that this whole situation is not being driven by the science at all, but rather by health bureaucracy, pharma companies, politicians, generally. So the argument goes like this: man, all these doctors, nurses, microbiologists, immunologists, epidemiologists and other researchers that keep saying is dangerous, but all these people who barely passed science in high school keep saying it's not. So hard to know who to believe anymore. And yeah, I think it's time to challenge this. So let's have a look. So the people who seem to be on the mainstream side, as far as I can work out, I'm yet to see a leading scientist, professional researcher, epidemiologist come forward and defend the mainstream case. I guess that's just how it is. The onus of proof seems to be on the dissenting side. So we do have a bunch of people. We've got this guy who is not a scientist, but he sits at the head of the World Health Organization. We've got this guy, again, who's not a scientist, but is very much driving policy. We've got this guy, again, not a scientist, but has a whole lot to say about what's going on and what we should be doing about it. All manner of people. This guy, again, who is not a scientist, but has the final word on the political measures that are put into place where I live. I'm actually under a stay-at-home order at the moment, but again, not a scientist. So, if that's the case, I think might be a reasonable question to ask: what do the actual scientists have to say? And I started researching this subject a while back, and I put up an article on my own blog, which I'll leave a link to down below. Wherein I listed a few of the actual scientists. Some seem to be pretty well leading figures in their fields from some of the world's most prestigious institutions. People like John Ioannidis, who noticed at the outset the statistical modelling wasn't quite right. He's quoted here as saying, in fact, we've seen even within the first few months of that the vast majority of the modelling that has been done has not really been able to get realistic predictions and inferences. Some of the modelling has led to very misleading inferences because people trust too much in these predictions and that they're based on them as if they were strong evidence when they're actually very weak evidence. Clearly realising that we don't have any good evidence is the first step, and it takes some brave people and some brave statements to really push and point that we don't have evidence. You need to convince others who say, I don't care, I just need to do something now because we have a serious situation here, and forget about evidence. I'm just going to act. And I think that we have a very high risk of doing harm. Unless we say we don't have evidence, let's get evidence that is trustworthy as quickly as possible. We've got Chris Whitty, who has a string of long letters after his name, who's a British physician and epidemiologist who serves as the Chief Medical Health Officer for England, Chief Medical Advisor to the UK Government, Chief Scientific Advisor to the Department of Health and Social Care, Head of the National Institutes for Health and Research, and Gresham Professor of Physics. Whitty says, most people, a significant proportion of people, will not get this virus at all at any point of the epidemic, which is going to go on for a long period of time. Of those who do, some of them will get the virus without even knowing it. They will have the virus with no symptoms at all, asymptomatic carriage, and we know that that happens. Of those who get symptoms, the great majority, probably 80%, will have a mild or moderate disease. Might be bad enough for them to have to go to bed for a few days, not bad enough for them to have to go to the doctor. And on. Professor Knut Witkowski, hope I pronounced that right, CEO and founder of Asdera, head Biostatics, Epidemiology and Research Design at the Centre for Clinical and Translational Science at the Rockefeller University, no less. Nothing is fundamentally different from the flus that we have seen before. Every couple of years there's a flu that's a bit worse than other flus were, and it gets away in exactly the same way as other flus went away, and this behaves exactly the same way. The epidemic has ended in China, it was ended in South Korea, and Iran is declining and will be declining, and on he goes. Mike Yeadon, former chief scientist and vice president of Pfizer. It's worth noting some of these comments are from 12 months ago, but we'll go on. Holds a degree in biochemistry and toxicology and a research-based PhD in respiratory pharmacology. He spent 32 years of his career working for large pharmaceutical companies and 10 years in the biotechnology sector. Yeadon on masks, social distancing and asymptomatic spread. To be a good, efficient source of infection, you have to have a lot of virus. And if you have a lot of viruses attacking you, you are fighting back. That process produces symptoms, inevitably, not just occasionally. It must always happen. And those people are not people who are walking around in the community, because if you're full of virus and symptomatic, you are also ill. And people tend to stay at home or in bed. Good point. There is absolutely no need for vaccinations to extinguish... Oops, I said the word, I'll probably get taken down. To extinguish the pandemic. Dear oh dear. I've never heard such nonsense talked about the... You do not... people who aren't at risk from a disease. You also don't set about planning to millions of fit and healthy people with a that hasn't been extensively tested on human subjects on lockdowns. Basically everything your government has told you about this you need to do is safe is a lie, every part of it. None of the key themes that have been talked about, from asymptomatic spread to pop-up booster injections, none of these things is supported by the science. Every piece is cleverly chosen adjacently to something that is probably true, but is itself a lie, and has led people to where we are right now. I don't normally use phrases like this, but I think we are standing at the gates of hell. Peter Stadler, biochemist, emeritus professor of immunology and former director at the University Institute of Immunology at Insel Hospital in Bern. First, it was wrong to claim that this V was novel. Secondly, it was even more wrong to claim that the population would not already have some immunity against the V. Thirdly, it was the crowning of stupidity to claim that someone could have without any symptoms at all, or even pass this along without showing any symptoms whatsoever. Dr. Roger Hodkinson is a general pathologist and fellow of Canada's Royal College of Physicians and Surgeons, who received his medical degree from Cambridge. He describes the as the greatest hoax ever perpetrated on an unsuspecting public. And goes on to say a lot of things. Gert van den Bosch. His credentials include Chief Innovation and Development Officer at UNIVAC, Program Manager at Gavi, Head of Development at German Centre for Research, Global Program Doctor at Solvay Biologicals, Research Director, Head of Adjuvants at Novartis, Head of New Biotech Vaccine Development at GSK Biochemicals. Bosch has recently published an open letter addressed to all authorities, scientists and experts around the world. It begins as follows. As stated, I am not against. On the contrary, I can assure you that each of the current have been designed, developed and manufactured by brilliant and competent scientists. However, this type of prophylactic is completely inappropriate and even highly dangerous when used in mass campaigns during a viral pandemic. Vaccinologists, scientists and clinicians are blinded by the positive short-term effects in individual patients, but they don't seem to bother about disastrous consequences for global health. Unless I am scientifically proven wrong, it is difficult to understand how current human interventions will prevent circulating variants from turning into a wild monster. Anyway, there's a few experts giving their expert opinion, but if you really want to dig into, not this guy, but what the experts are saying, I really recommend this series of articles which I've just noticed at Off Guardian, where they list a whole lot of experts and doctors giving their medical opinions. And I guess, I'm not sure how long I've been going for, but probably too long. I wanted to keep this short, but let's have a look. So 12 experts questioning the Dr. Sukarat Bhakdi is a specialist in microbiology. He is a professor at the Johannes Gutenberg University in Mainz and head of the Institute for Medical Microbiology and Hygiene and one of the most cited research scientists in German history. It's high praise. What he says: we are afraid that 1 million infections with the new will lead to 30 deaths per day over the next 100 days, but we do not realise that 20, 30 or 40 or 100 patients positive for normal are already dying every day. The government's anti-measures are grotesque, absurd and very dangerous. The life expectancy of millions is being shortened. The horrifying impact on the world economy threatens the existence of countless people. The consequences on medical care are profound. Already service of patients in need are reduced, operations cancelled, practices empty, hospital personnel dwindling. All of this will impact profoundly on our whole society. All of these measures are leading to self-destruction and collective suicide based on nothing but a spook. Okay. Dr. Wolfgang Wodarg is a German physician specialising in pulmonology, a politician and former chairman of the Parliamentary Assembly of the Councils of Europe. In 2009 he called for an inquiry into the alleged conflicts of interest surrounding EU responses to the swine flu pandemic. What he says: politicians are being courted by scientists who want to be important to get money for their institutions, scientists who just swim along in the mainstream and want their part of it. And what is missing now is a rational way of looking at things. We should be asking questions like, how did we find out this was so dangerous? How was it before? Didn't we have the same thing last year? Is it even something new? Dr. Joel Kettner is a professional community health sciences and surgery at Manitoba University, former Chief Public Health Officer for Manitoba Province and Medical Director for the International Centre of Infectious Diseases. What he says: I've never seen anything like this, anywhere near like this. I'm not talking about the because I've seen 30 of them, one every year. It's called influenza and other respiratory illness and viruses. We don't always know what they are, but I've never seen this reaction, and I'm trying to understand why. I worry about the message to the public, about the fear of coming into contact with people, being in the same space as people, shaking their hands, having meetings with people. I worry about many, many consequences related to that. Right, I'm not going to it's probably too time consuming to quote directly from all of these doctors and experts and scientists, but there are a whole lot of them, so we'll go and have a look at some of them and some of their credentials, and remember that these are experts, scientists, academics who are questioning the mainstream narrative, the public health advice that's issued by health bureaucracies and politicians and their health ministers and so forth. So here we've got Dr. Yoram Lass, is an Israeli physician, politician and former Director General of the Health Ministry. He also worked as Associate Dean of the Tel Aviv University and Medical School. During the 1980s presented the science-based television show Taspid. Dr. Pietro Vanazza is a Swiss physician specialising in infectious diseases at the Cantonal Hospital in St. Gallen and professional health policy. Sorry if I pronounced that wrong. Frank Ulrich Montgomery is a German radiologist, former president of the German Medical Association and deputy chairman of the World Medical Association. He says, I'm not a fan of lockdown. Anyone who imposes something like this must also say when and how to pick it up again. Since we have to assume that they will be with us for a long time, I wonder when we will return to normal. You can't keep schools and daycare centres closed until the end of the year, because it will take at least that long until we have a... Anyway. Yeah, I said I wasn't going to quote, so we won't. Professor Hendrik Streeck is a German HIV researcher, epidemiologist and clinical trialist. He is a professor of virology and the director of the Institute of Virology and HIV Research at Bonn University. Dr. Janis Roussel, etc. A team of researchers from the Institut Hospital Universitaire Mediterranean Infection, Marseille, in the Institute... I can't read French. Is that even French? Dr. David Katz is an American physician and founding director of the Yale University Prevention Research Center. Michael T. Osterholm is Regents Professor and Director of the Center for Infectious Disease Research and Policy at the University of Minnesota. Dr. Peter Goetsche is Professor of Clinical Research Design and Analysis at the University of Copenhagen and founder of the Cochrane Medical Collaboration. He has written several books on corruption in the field of medicine and the power of big pharmaceutical companies. And that's the end of that one, but wait, there's more. Off Guardian have produced another article here. And we have Dr. Sunetra Gupta et al. An Oxford-based research team constructing an epidemiological model for the outbreak. Their paper has yet to be peer-reviewed, but the abstract is available online. Dr. Gupta is a theoretical epidemiology. He's Professor of Theoretical Epidemiology at the University of Oxford with an interest in infectious disease agents that are responsible for malaria, HIV, influenza, bacterial meningitis. She is a recipient of the Somebody Award and Scientific Medal by the Zoological Society of London and Royal Society Rosalind Franklin Award for Scientific Research. Really sorry about my pronunciation of some of these names. I'll do my best. Dr. Karen Molling is a German virologist whose research focuses on retroviruses, particularly human immunodeficiency virus. She was a full professor and director of the Institute of Medical Virology at the University of Zurich from 1993 until her retirement in 2008 and received multiple honours and awards for her work. Dr. Anders Tegnell is a Swedish physician and civil servant who has been state epidemiologist for the Public Health Agency of Sweden since 2013. Dr. Tegnell graduated from medical school in 1985, specialising in infectious disease. He later obtained a PhD in medical science from Linköping University in 2003 and a MSc in 2004. Dr. Pablo Goldschmidt is an Argentine-French virologist specialising in tropical diseases and professor of molecular pharmacology at the University Pierre Dear oh dear, these French names. He is a graduate of the Faculty of Pharmacy and Biochemistry of the University of Buenos Aires and Faculty of Medicine of the Hospital Centre of somewhere in Paris. He currently resides in France, where he's worked for almost 40 years as a researcher in clinical laboratories developing diagnostic technology. Dr. Erin Ben David and Dr. Jay Bhattacharya are professors of medicine and public health at Stanford University. Dr. Tom Jefferson is a British epidemiologist based in Rome. He works for the Cochrane Collaboration, where he is an author and editor of the Cochrane Collaboration's Acute Respiratory Infections Group, as well as part of 4 other Cochrane groups. He is also an advisor to the Italian National Agency for Regional Health Services. Dr. Michael Levitt is Professor of Biochemistry at Stanford University. He is a Fellow of the Royal Society, a member of the National Academy of Sciences, and received the 2013 Nobel Prize in Chemistry for the development of multi-scale models for complex chemical systems. In February this year, he correctly modelled that the China outbreak was coming to an end, predicting around 80,000 cases and 3,250 deaths. Graham Network for Evidence-Based Medicine is an association of German scientists, researchers and medical professionals. The network was founded in 2000 to disseminate and further develop concepts and methods of evidence-based and patient-oriented medicine in practice, teaching and research, and today has around 1,000 members. Dr. Richard Shabas is the former Chief Medical Officer in Ontario, Medical Officer of Hastings and Prince Edward Public Health, and Chief of Staff at York Central Hospital. And I'm sure the list goes on. Let's find another follow-up article. 8 more experts questioning the pandemic. Can I say that word? Dr. John Lee is an English consultant histopathologist at Rotherham General Hospital and formerly clinical professor of pathology at the Hull York Medical School. He is most notable to the wider health public as co-presenter with Gunther von Hagens of Anatomy for Beginners. Dr. John Oxford is an English virologist and professor at Queen Mary University of London. He is a leading expert on influenza, including bird flu and the 1918 Spanish influenza and HIV/AIDS. Professor Knut Witkowski, I've mentioned before, so we'll pass him. Dr. Klaus Puschel is a German forensic pathologist and former Professor of Forensics at Essen University and current Director of the Institute of Forensic Medicine at the University Medical Center Hamburg-Eppendorf. He has worked on many noteworthy autopsies as well as high-profile forensic archaeological studies. Contrary to the guidelines of the Robert Koch Institute, his office in Hamburg has started to differentiate between deaths with and from, which has led to a decrease in deaths. Dr. Alexander Kukuli is a German doctor and biochemist. He has held the chair for medical microbiology and virology at Martin Luther University, Halle-Wittenberg since 1999 and is the current director of the Institute for Medical Microbiology at the University Hospital of Halle. Dr. Klaus Conlon is a German internist based in Kiel and co-author of the book Virus Mania. Dr. Gerhard Kraus is head the Department of Epidemiology at the Helmholtz Center for Infection in Braunschweig. How did I go there? Braunschweig. Director of the Institute for Infectious Disease Epidemiology at TwinCore in Hanover and chair of the PhD program Epidemiology at the Hanover Medical School. He also coordinates the translational infrastructure epidemiology in the German Center for Infection Research. I'm sure there are a bunch of typos in that. Can't be all me. Dr. Gerhard, here's a fun one, Gerhard Gigerenzer is a German psychologist, professor of psychology and director of the Harding Center for Risk Literacy at the Max Planck Institute for Human Development in Berlin. And bonus, Dr. Pietro Venazzo of Switzerland was featured in our first experts list, but he has since written 4 more articles on various aspects of the including testing programs, medical masks, and closing schools may be counterproductive. I'm going to put all these links up in the down underneath. But in the meantime, another 10 experts questioning the panic. Dr. Dolores Cahill is an Irish research scientist specialising in immunology and oncology and professor of the translational science at University College Dublin School of Medicine. She has been a science advisor for 3 national governments, Ireland, Sweden and Germany, and is the vice chair of the scientific committee of the Innovative Medicine Initiative. She has also been asked to resign from her post at the IMI due to her stance on well. Professor Carl Hennigan is a British general practitioner, physician, director of the University of Oxford Centre for Evidence-Based Medicine and fellow of the Kellogg College. He is also editor-in-chief of the BMJ Evidence-Based Medicine. He is one of the founders of All Trials, an international initiative calling for all studies to be published and their results reported. Seems fair. Dr. Carol Sikora is a British physician specialising in oncology and professor of medicine at the University of Buckingham. He is the founder and medical director of Rutherford Health, a company providing proton therapy services, the former director of the World Health Organization Cancer Program, and director of medical oncology at the Bahamas Cancer Centre. Dr. Michael Uden, we've mentioned before. Dr. Jean-Francois Toussaint is a French doctor and professor of physiology at the University Paris-Dakar. He was a director of the Institute for Biomedical Research and Sports Epidemiology and former member of the High Council of Public Health. I'm not even going to try and pronounce that name. He's a British surgeon, medical researcher and NIHR clinical lecturer and specialty registrar in cardiothoracic surgery at Hull York Medical School. I should have an attempt, shouldn't I? Dr. Priyad Ari Atnam. Dr. Martin Feely, who you may remember from the introduction, is an Irish physician and former senior doctor with Ireland's Health Service Executive and Clinical Director of the Dublin Midlands Hospital Group. After giving an interview in which he questioned draconian lockdown on September 12th, he was pressured into resigning on September 18th. Well. Dr. Peter Stadler, I think we've mentioned him before. Dr. Stefan Hochertz is a German researcher in the field of biology, biotechnology and pharmacology and former professor of toxicology, pharmacology and molecular immunotoxicology at the University of Hamburg, as well as a member of the Fraunhofer Working Group for Toxicology and Environmental Medicine. Dr. Hochertz has also worked as director of the Institute for Experimental and Clinical Pharmacology and Toxicology at the University Hospital Eppendorf, and the founder and managing director of TPR Consult, a biotech research company. Docs for Open Debate is a collection of healthcare workers based in Belgium. Last month they posted an open letter to the Belgian government demanding an end to lockdown, and that at that time the letter has accrued 13,000 signatures, 561 of whom are medical doctors. Their inclusion could justifiably turn this from 10 experts into 570 experts, but that feels like overkill, possibly. Bonus. Dr. Sukarat Bhakti, the first expert featured in our very first list, has since published a book on the crisis called False Alarm. Is available in English and German. Altogether, our collection of experts now numbers 40. Anyway, it seems to be quite a large list of medical experts and scientists and so forth. So to go back to our original, where was it? Argument. Man, these doctors, nurses, microbiologists, immunologists, epidemiologists and other researchers keep saying that is dangerous, but all these people who barely passed science in high school keep saying it's not. Really? Is that what you got? Because as far as I can see, the people that are saying it's deadly and we need to lock down and take experimental injections and have passports to actually have access to public life, to shop and to travel and to live our lives, seem to be this guy and this guy and this guy and this guy. Those are the experts that you are putting your faith in. As far as I can work out, but you may have a different opinion. Let me know. I'll put some links up in the comments below. Sorry this has been a long video, and sorry again for my shit pronunciation of some of the names, but yeah, stuff needs to be said, eh? Ciao.